Hi, my name is Linyana and I'm an acupuncturist located in New York City. Today I'm going to talk about how far acupuncture needles actually go in. Maybe you've scheduled your first appointment with me or a consultation, or you're just thinking about acupuncture, or whatever. You're curious about how far the needles go in. So what I will say is the depth of the needles depends on where the acupuncture is treating. For instance, if I am treating your finger, the needle will only go in maybe a few millimeters, okay? If I am treating your abdomen, it may go in a few inches. If I am treating your glutes, it may go in up to, maybe 4 inches. And it really all depends on the location in your body. If you are a person that's a little bit more on the thin side, I can reach your muscle a little bit faster. So the acupuncture needles will be shorter, maybe about an inch or a half an inch. It just depends. But if you are a little bit more robust, you're a little bit more healthier on that side, then I'll have to use longer needles so that I can get through the adipose tissue and then into the muscle area, okay? But all in all, acupuncture, the needle depth on your fingers and on your feet will be a lot more shallow as compared to on your abdomen or your legs or your lower back or your glutes, okay? The acupuncture needles on the upper back, for instance, I have a lot of people that have like the shoulder pain in here, they have like achy traps in here. The needles may go in about a half an inch. Like I said, it has to get past the fat tissue and into the muscle. I can always tell when I've hit the muscle, and it usually doesn't take me very long. But us acupuncturists, we have to be really careful on the upper shoulder and on the upper back because the lungs are right underneath. It's right there, and the needles, they don't really go in as deep if there's not a lot of muscle mass. If you have more muscle mass, then I'll use a longer needle to make sure that the treatment is actually effective. Some people, if the needles are too shallow, it's like you really don't feel much. And I want people to have a good experience. I want the energy to circulate, the way it's supposed to be. And so deeper needling is sometimes needed, especially if you're coming in for pain. If you have pain, I have got to get to your muscle. And me getting to your muscle usually means that the needle will go in a little bit deeper, okay? I just have to do that, all right? But if you're coming in for something like anxiety or you can't sleep, then shallow needling is usually okay with that. But all in all, they don't go in very, very deep. Like I said, it really just depends on the body part. So yeah, that's that. I'll talk to you soon.